guys, welcome back to my channel, and today we're going to be talking anatomy. Specifically, we're going to be talking about the piriformis muscle. If you want to know what this muscle does and how to keep it in top shape, stay tuned to the end of this video to find out how. The piriformis is in the gluteal region, and the Latin base of the word means pear, kind of talking about the pear-like shape of the muscle. The origin of the piriformis is on the anterior sacrum, which is the bottom of the spine, with the insertion being on the greater trochanter, which is on the femur or your thigh bone. It's a flat muscle living partially in the hip and partially in the pelvis. Its main job is to externally rotate the hip, so opening the hip up. You can think about where the origin and insertion are, and that makes sense. When it gets shorter, it kind of turns the femur out. It's innervated by the nerve to piriformis, easy to remember, which comes from L5, S1, and S2 nerve roots, and blood comes from the inferior gluteal artery, the lateral sacral artery, and the superior gluteal artery. Piriformis is a muscle we commonly will assess during a chiropractic visit. Tightness and weakness are very common in this muscle, and that can cause just general issues with firing and external hip rotation issues if there's weakness, but it can also lead to sciatica-like symptoms. This comes from the fact that the sciatic nerve will typically either go over, through, or underneath the piriformis, depending on your anatomical structure. So if there's weakness or tightness, that can either clamp down on the nerve, or if the muscle's weak, it can actually fall on top of the nerve, irritating it, giving you sciatica-like symptoms, which is usually numbness, tingling, weakness, pain down the leg in a specific pattern. We call this piriformis syndrome, and a lot of people do deal with this issue, especially with the amount of time that we spend sitting. So working on strengthening and stretching the muscle are very important parts of treatment plans for someone dealing with this issue. Some things we can do in office is adjusting the pelvis, doing trigger point work, pinning and stretching the muscle to release it. And then the next thing we would do is a lot of homework, so exercises. So I'm going to show you 4 different exercises that you can do to help with both piriformis flexibility, mobility, and strength. Hey everybody, so this is the exercise part of the video where we're going to talk about what to do for piriformis. The first one we're going to do is a stretch, and then the last 3 are more stability, strength type of things. If you do have a circular band, that can be helpful for some of these. I'm going to show it without, but I will kind of tell you when you can use those if you'd like. So the first one is the figure 4 stretch, or the thread the needle stretch, which I'm sure most of you have heard of. So we're going to go on the back here. And of course, with everything, we're going to do it on both sides, regardless of symptoms. Clipping my hairs. There we go. So you're going to cross ankle over opposite knee. Hands, thread the needle, grasping the opposite knee, because we are stretching this leg that's crossed over right here. And what you're going to do is just gently pull your knee towards you, and you should feel a stretch starting in the bum, and you can also feel it in the general outside of the hip here. So for all stretches, you want to hold for about 20 to 30 seconds. If you feel any pain, sharp pain, that sort of thing, pull out of the stretch, but a little achy, stretchy feeling is normal. Of course, we're going to switch sides. As we do everything on both sides, and hold this for 20 to 30 seconds as well. Now, stretching can be done every day, and I usually tell my patients to do it at least once a day, if not twice, especially at first, just to get some mobility and flexibility going. It's pretty hard to overstretch unless you're stretching for hours a day and not doing any strength or stability work. But if you want a little more guidance, having a coach or a physio or a chiro work with you is the best option. All right, so that's our figure 4 stretch. You can also do it seated, same kind of idea, cross ankle over knee and then just kind of bend forward in the chair. If you're in the office or something like that, you can do that. The next thing we're going to do is a clamshell. This is a pretty basic move for working the outer hip, piriformis, glute med, those sorts of things. Of course, none of these are specifically just piriformis. They're going to work other muscles that do those movements, but we'll give them to people with piriformis issues, of of course. So clamshell. Ideally, if you can do this against a wall, that'll help keep you in proper alignment, but I'm just gonna do it here. So legs kind of bent, about 90 degrees-ish. If you want, you can put a band around your knees here, just above the joint. And then what you're going to do is raise the knee up and down, like a clamshell, opening and closing. You're going to feel it right in the outer hip. Now you don't want to open up and let your back flare away and do all that sort of stuff. Everything stays neutral and stable, and you open just as far as you can while maintaining that. So no flaring, thing like that. Just a nice easy open and close. Open and close. So for this one, I will typically say 12 to 15 reps on each side, 2 to 3 sets every few days. It's a great thing you can kind of add into a workout program if you already have one, if you're doing weights and that sort of thing. So don't feel like you need to stop necessarily doing a program that you already have, but we can just kind of slide these exercises in. Okay, the next ones, we did figure 4, we did clamshells. The next one we're going to do is a glute bridge. Again, you can use a band with this one. So band, again, going just above the knee joint. And for this one, the band is kind of what makes it more of a outer hip movement. Just gonna take the clip out on here for a second. So when we come up, really squeezing glutes. And then if we have, imagine the band around my knees, we're gonna push out slightly. And that's going to engage our hip abductors and our external rotators here. So you can stay up and then just kind of in and out, or you can go up, down, and then out when you're at the top. So down, up, that sort of thing. You don't necessarily need the band to do this one, but it can be helpful just to have some resistance to really focus on the external rotation and the abduction of the hips. So that is our glute bridges. Again, 12 to 15-ish. We are kind of looking more at not necessarily hypertrophy or muscle growth with these. So it's not necessarily needed. You don't need to put weight or anything in there. Body weight's usually enough, especially when we're doing rehab type work. You can add weight to this stuff later, but we're starting pretty much at basics here. The last one, which I am going to attempt to show you, but it's very difficult for me to do as well, it's more advanced, is a single leg deadlift. So a lot of us love to do regular deadlifts and move lots of weight, and that's great, but this one is super helpful, to help with hip stability and all that sort of stuff, which is super important. So this one is kind of standing. I'm just gonna move you up. Here we go. So for this one, pretty much kind of what it sounds like. So you're gonna support yourself on a leg. I'm gonna start with my left leg here. Right leg slightly bent. Again, you can add weight to this one later, but I can't do that yet. So keeping hips nice and square. You're gonna slowly at the hip, hinge down, and hinge up. Whew. So testing balance, testing stability, all sorts of stuff. Make sure you're not locking out your support knee. Make sure you have a little tiny micro bend. My yoga people out there will know what I'm talking about. And only go as far as you feel comfortable, with the goal eventually being completely horizontal, and then back up. And of course repeat on the other side. You can add weight to that one, either both hands, one hand versus the opposite. You're kind of treating things a little differently based on that, which we can go through in a different video if you guys want. But just for basic rehab purposes, that's a pretty advanced thing we can do to help with hip rotation, hip stability, piriformis weakness, that glute med weakness, that sort of thing. So 4 exercises, 1 stretch, 3 stability strength exercises. If you have any questions about them, feel free to drop them in the comments below and I'll do my best to help. If you do need more support, please do reach out to a coach or a chiro or a physio. If you want a direct referral from me, just let me know where you are and I can see if I can find somebody for you. All right, hope that helps you guys. So there you have it, 4 exercises to help you keep your piriformis nice, healthy, and happy. I hope you guys liked this video. Comment below if you have any questions about piriformis or what muscle you'd like to see next. Please don't forget to like and subscribe, and I'll see you in the next video.